When I first noticed it, I didn't actually tell anyone, due to embarrassment, because I didn't understand what it was.
It was quite a big thing as a young female, and not knowing what it was for so long.
It was a very painstaking process to get there. It was a lot of I just have to live with it.
Hidradenitis suppurativa, or HS, is a painful chronic inflammation of the skin affecting the armpits, buttocks, groin and genital skin. The disease can cause a profound impact on patients' mental health, relationships and ability to work. And these are some of our patient stories.
It was around 13 years ago. I just started to get really small, red, quite painful lumps under my armpits and a few on my face. I was just worried that I had a constant infection all of the time, and the lumps were very painful. It was horrible to look at.
At first it was kind of upsetting, but I feel like for me personally, I just came accustomed to it. I know it may affect you in the sense of how it looks. So I wouldn't wear t-shirts in the sense because you'd see it on my actual arms and under my armpits, and the area just felt tender in itself.
You feel like it's a dirty disease. You feel something that you're doing is causing it because you want to try to find a cause for something and try to place it in a little box and say, right, that's why it's happening. This is what I need to do to solve it, and this isn't something that you can do that with. And it's weird because someone could just make a passing comment and be like, I had a disgusting spot this morning. I got a spot on my head. Oh my God, I can't go out. And you're thinking, well, my armpit is on fire.
In some patients, surgery has a role, and there are different types of surgery that patients with hidradenitis will have experience of, often presenting to accident and emergency for the cyst to be opened up is all that's required. However, sometimes our surgical colleagues can offer much larger procedures, for example under the armpit, where all the affected tissue is removed and then the area is reconstructed.
I think surgery is not something that you would choose to do before medical therapies, and the dermatologists are saying to us that it's time to consider surgery. And our job is to try and work out how much improvement in quality of life we can give our patients without them being too scared or too frightened of the kind of surgeries we're suggesting.
I'm going to have a skin graft for my hidradenitis on my left armpit. So then basically after I leave the waiting area, I'll be taken to general surgery. It's they'll take a part of skin off my right leg and then make an incision in my left armpit and literally place the skin that they've taken from my leg to fill the wound that they've made on my armpit.
I think we can genuinely cure this condition for these patients, and they may have lived for many, many years with really significant disease. So yeah, I think it can be very life-changing for them.
I'd even go to the extent of saying there's maybe like a Stockholm syndrome with it, where you're like, what am I going to do about it? I've found a way to live with it. By doing the surgery, there's always a risk. I feel like it's been my choice to make, not something that's been forced upon me.
I'm very happy with the actual result itself. I'm just practically healing from it, but how I am right now in regards to my arm, there's a huge difference as it was before I had the operation itself.
So the scars are under my arms, and I think it's turned out amazing. It's completely changed my arms. The scarring is really, you can't really see it, it's not really noticeable, and it's such a big difference to what was there before.
When you see what people are suffering and see them walking in, smiling, happy, not anemic, eating properly, gaining weight, holding down their job, going out with their families, it's so good.
It's changed your life, hasn't it? The surgery has completely changed your life.
A lot. Don't be afraid. That's it. Don't be afraid.
There's always risks with surgery. There can be complications. The scar might not look quite how it was expected to look, but I think the surgery that we can offer for this condition is life-changing. I haven't yet had a patient say to me, I wish I hadn't done that. Please talk to your dermatologist if you think that surgery may be of benefit as a treatment for your HS.